Hi friends, I'm Dr. Thinesh Chandar, Orthopaedic Surgeon at Lifeline Hospital, specialist in arthroplasty, arthroscopy and limb lengthening surgeries. So I'm here to talk about arthritis of the knee joint. So arthritis of the knee joint is one of the most common arthritis of all the joints in the body, and it's also called a wear and tear arthritis. So the most common cause of an arthritis is because of old age, and where usually you find it more commonly in patients who are above 50 years of age. Second is because of being an overweight person for a longer duration in life. Third is sometimes when your height is a bit more shorter with overweight can also accelerate osteoarthritis. The other reasons of osteoarthritis can be direct trauma to the knee joint and continuous squatting down and getting up position, or it can also be a hereditary cause. So what happens in arthritis is that when the cartilage in your knee joint, which gives you the cushioning effect and make sure that your joints do not get degenerated, is where the cartilage starts getting damaged. So that is what leads to arthritic changes. So as you can see here, as your knee joint is being presented, so this is your patellar bone. So as you can see here, the blue color part, this is your cartilage. So this cartilage will start wearing off. As you can see, multiple white spots. So these areas, when it comes in contact with bone, and every time when you start bending your knee and extending it, these cartilages start degenerating, and that's when your bone starts rubbing with the bone, and there's no cushioning effect in between two bones. That's the reason you start having pain, and that's the reason you go into osteoarthritis of the knee joint. Okay, so what are the treatment for osteoarthritis of the knee joint? So you have multiple stages called grade 1 to grade 4. Grade 1 being the most basic, simple, mild pain with walking or while squatting or getting up from a sitting position. So these are things which might cause you pain, especially if you walk for longer distance. Okay, so these conditions can be easily treated with oral drugs and physiotherapy. At the same time, even grade 2, where you might have a little bit more severe pain, but then it's not very painful and they will be able to do all the activities. And so in these conditions, the grade 1 and grade 2 can be treated just by medications and by proper physiotherapy. Grade 3 is a little bit more severe, where your bone changes started happening a bit more earlier, where your cartilage damage also is much more extensive. In that cases, what happens is usually a knee injection called a hyaluronic injection or a PRP or a stem cell therapy can really be helpful depending upon the MRI or the changes which occur within your knee joint. And the stage 4 is the one which is the most severe, where even when you are able to stand, not able to stand for more than even 5 minutes, or you're not able to walk for more than 500 meters in one stretch, or sometimes when you have severe pain, or what we call it as rest pain. So when you're lying down in your bed and you still have pain in both your knee joints, and when your x-ray shows complete destruction of the joint space, and where your bones start rubbing between two, is when you will actually have to plan for a total knee replacement. So let's talk about knee replacement as such. So what do we do in knee replacement is we actually replace the complete cartilage area and the joint where the bones do not touch to each other. So what happens is, in that case, is that the cartilage over here is fixed with a metal, and you can see the bottom part here also is another metal, and here you have a silicone shaped kind of poly joint, so which makes sure that the two metals, while it rubs, it gives you that cushioning effect like how you have in your normal knee joint. So these really help patients to walk pain free. They start walking on day 2 of surgery itself, after surgery, and within a month they feel that they are young as they were 40 years age, and this really helps them to go back to their usual activities which they were not able to do for 4 to 5 years because of severe knee pain. And a lot of patients even start going to cycling and start doing swimming and start going out and have a normal life after knee replacement surgery if it's all done well. And this really helps to go back to your normal life, and this gives you that whole freedom to be with everybody else but not be restricted to your due to the pain. Okay, so thank you.